After almost 1,200 days and being a staple in Taiwanese lives, daily COVID-19 briefings came to an end last Friday. As of May 1st, the Central Epidemic Command Center, the government agency overseeing the handling of the COVID pandemic, is officially disbanded. These are among a spate of recent changes in post-pandemic Taiwan. Labor Day also saw the government downgrade COVID to a Class 4 communicable disease, the same as severe flu. Masks are now optional on public transport, and soon clinics will be able to charge for COVID vaccines. After 3 years, COVID-19 prevention has all but ended in Taiwan. And out on the streets, many people think it's about time.
应该是对吧？因为已经很久了。
可以啊，因为台湾是一个岛国啊。
我觉得是对的，对，就是慢慢大家就是 COVID 结束的话，大家就慢慢松绑，我觉得可以跟病毒一起共存。
Taiwan has received widespread praise for its handling of the pandemic. In 2020, the country went 255 days without domestic transmission of the disease. Taiwan was quick to set up strict quarantine requirements for all international travelers. Those stayed in place until October 2022, much later than many other places. The death rate was also around 3 times lower than in countries like the United States or United Kingdom. For public health professor Zeng Zhongmei, Taiwan succeeded because of effective data collection, a centralized response, and public trust in the government. She also says the country's experience with SARS in 2003 had a major impact. Taiwan had the second highest death rate per capita from SARS in the world.
It really pained Taiwan, pained the whole society and the government. So they swore at that time, never again, never again.
But in 2021, Taiwan's COVID response faltered. Domestic cases surged in May that year after a hotel mixed up quarantine and non-quarantine rooms. Taiwan entered a semi-lockdown for 2 months and recorded over 700 deaths. Professor Zeng hopes the authorities will learn from this mistake.
A very important lesson is that they should not, again, sit on their laurels. When things are good, don't just relax. Never relax. Always be vigilant.
Still, during this period, Taiwan saw record GDP growth. The vaccination rollout was also overwhelmingly successful, with over 90% of people in Taiwan being at least partially vaccinated. But despite the praise and impressive statistics, Taiwan's handling of the COVID pandemic often fell short, particularly for marginalized groups. In 2021, Miaoli County in central Taiwan carried out strict lockdowns that targeted migrant workers, many of whom lived in shared dorms. Taiwan's government watchdog later said the move was discriminatory. Activists also say the country failed to provide equal services for people with disabilities, who were not able to get COVID vaccines early despite being at higher risk.
其实在防疫政策的时候，不就是针对这些高龄者或身心障碍者应该优先去考量吗？那很可惜在这一次的疫情当中，我们反而常常都是最后才被想到的那一群。
At the last COVID briefing, the government emphasized that COVID care would remain the same, even as the disease was downgraded. As restrictions are dropped, it seems that many people think the time is right for a return to normal, or perhaps for a new normal to emerge. Eason, Chen, Devin, Tsai, and Robbins for TaiwanPlus.